Wonderful. Here is our proposed agenda for today's meeting. Um, this event is designed to unveil the state bills and budget policies that the San Diego Hunger Coalition has identified that we believe will move the needle to end hunger in our region. It is our goal that everyone on this call will leave with a clear understanding of the current need in San Diego, the bills we're supporting, and why we're supporting them. So I will now hand it off to talk a little bit more about the San Diego Hunger Coalition to San Diego Hunger Coalition President and CEO, Alondra.
Hello, everyone. Thank you, Mauricio. My name is Alondra Alvarado, and I'm the President and CEO of San Diego Hunger Coalition, and I'm very happy to be here and also thankful with 7 Mile Casino, who is making this forum possible this year. Here at San Diego Hunger Coalition, we coordinate action to end hunger in San Diego County. We do this through 3 different areas. The first one is research. We have a Hunger-Free Advisory Board and Community Advisory Council, and we do research and we provide data on the hunger situation in San Diego County, meal gaps, CalFresh registration, and topics like that. We also use this data so our partners and other community members can be more strategic about how they are allocating their efforts and their resources to end hunger in San Diego County. We also have this data divided by electoral districts, and then we provide this data to legislators so they can decide and make more informed decisions about the policies that they are making or enforcing or creating. And we also have a CalFresh outreach and education program, and we also have the navigator training, CalFresh 101, where we give resources, provide resources to partners and community members so they can understand better how the program, how the food assistance programs are in San Diego, here in San Diego. The next one, please. And talking about more specifically about our policy and advocacy work, we have more than 330 nonprofit organizations that we partner with. And then the work that we do is we work on creating equitable access to food assistance. And one of the things that we do is we elevate the experiences of people struggling to access health and affordable food. We also engage and act as a resource for policymakers by providing research, policy analysis, and case studies of what's happening in San Diego County, as I was mentioning in the previous slide. We also work in coordinating local actions, including meeting with policymakers, calling days, and later campaigns to support local, state, and federal legislation. The next one, please. One of the work that we've done, and I think that last year it was one of the biggest things that we did, is that we work with legislators and other nonprofits to create an expansion to the PEBT 2.0 reissue, that word. And then what happened with PEBT 2.0 is it was $1,200 in food benefits for families. And some of these PEBT cards were sent to houses with old addresses, or some of the families didn't even know what it was about when they received the card, so they didn't use the money that they could use to buy groceries. So what we work on is in advocating, so there was an expansion of the time where people can actually add to receive back those benefits, and they can use it to provide food for their families. We were very successful in California. We were the county, San Diego County was the one that created more brought in more reassurances to the families. And then here you can see some of the pictures of the work that we did with media, and then we were working with elected officials, with other nonprofits, and we're working with school districts. So this is a little bit of the work that we do. This all information is on our website. You can also find it on our press room if you have more interest on learning, if you have interest in learning more about how this worked last year. And if you want to join us and be part of this year's advocacy efforts that we're going to be doing, I'm going to pass it to Mauricio, and he's going to be explaining what are going to be the rest of the team is gonna be explaining what we are gonna be focusing this year in the legislation side of our organization and advocacy. Thank you, Mauricio.
Wonderful. Thank you, Alondra. I'll hand it over to San Diego Hunger Coalition's research manager, who will show a little bit more of a snapshot on hunger in San Diego.
Thank you, Mauricio. Yeah, so I'll be kind of going through our kind of a brief snapshot of hunger in the county with our brand new September 2023 data, which is now available on the research page of our website. As you can see here, as of September 2023, the nutrition insecurity rate for San Diego County has increased to 25%, meaning that 1 in 4 people in the county cannot afford 3 nutritious meals per day. In total, there are now about 832,000 nutrition insecure people in the county, including 214,000 children, 170,000 older adults or people aged 60 plus, and 141,000 living with disabilities. Our data clearly show that nutrition insecurity disproportionately affects children and people with disabilities, but also people of color. Slide. Here you can see a graph of the nutrition insecurity rate by quarter since June of 2022, showing the increase in September, which comes amid about 6 months of gradual increases in nutrition insecurity, up from 22% in September of 2022. And so why is nutrition insecurity increasing? The first reason is a decrease in wages. So while recent Bureau of Labor Statistics data clearly show that hourly pay is increasing in San Diego, these wage rate increases are not translating to higher paychecks overall. In the third quarter of 2023, the Bureau, or BLS, reported a 3% decrease in the average weekly wages of workers in San Diego County compared to the previous quarter, and a 2% weekly wage decrease from a year prior. This decrease in weekly wage means that workers are working less hours per week, resulting in a low paycheck. So while workers are making more money per hour, this doesn't automatically translate to a higher paycheck, and the lower paychecks across the board result in more nutrition insecure families. The second reason is for the continued increase in the cost of living here in San Diego. So alongside this decrease in weekly wages, prices in San Diego are still on the rise, making it harder for families to provide 3 meals a day. The BLS reported another 3.8% increase in prices in January of 2024 compared to a year prior for the San Diego area. This is a 10% increase compared to last year, and a 20% increase compared to 10% increase from 2 years ago in 2022, and a 20% increase from 2021 prices, showing that continued inflation is still resulting in painful consequences for San Diegans, especially since their wages are now lower than they were last year. These continued higher prices are majorly affecting San Diegans through things like housing, including rent, gas, and food prices. Next slide, please. The increase in nutrition insecurity results in more people looking for food assistance around the county, and to assess how the county's food assistance sector is doing, it's essential for us to measure how many meals are being provided. Food assistance comes in several sources or several different ways, such as government programs like CalFresh or SNAP, the Women, Infants, and Children program, school meals, and from charitable food distributions provided by food banks and pantries. This chart here illustrates how much assistance came from each of the major types of food assistance in September, clearly with CalFresh or SNAP continuing to be the largest source with 47% of all assistance. All food assistance combined for about 28 million meals to San Diegans in September. And of note, the last round of pandemic EBT was issued in September of 23, which was PBT 4.0, or that red slice here in the chart, and it provided a total of 7.6 million meals, but 2.5 million of them came in September. In total, it was about $35 million of issuances. And although this marks the final round of all pandemic era assistance, it also foreshadows the increase that we'll be seeing starting this summer from the new permanent summer EBT or Sunbucks program. The coalition estimates that this will provide roughly 1 to 2 million meals in summer months to families in need. And then outside of these two federal programs, food banks and pantries also provided an estimated 3.5 million meals to people in need in September. So to talk more about the need they're actually seeing on the ground, I'd like to hand it over to Maria Lewis from the San Diego Food Bank, which is one of the largest providers of food in the county.
Thank you, Joseph. Like he mentioned, my name is Maria Lewis. I am a CalFresh Outreach Coordinator here at the San Diego Food Bank. CalFresh stands as California's largest food assistance program, offering crucial monthly benefits that serve as significant support for families managing their budgets. In recent times, like Joseph mentioned, there has been a noticeable surge in the demand for food assistance, even for individuals and families who have never saw aid before. This uptick can be attributed to the escalating cost of essential needs such as food, shelter, transportation, and healthcare. The CalFresh program plays a vital role in addressing food insecurity by providing invaluable support. Not only does it enhance nutrition and promote better health outcomes, but it also serves as a tool in the fight against poverty. Additionally, it contributes to the local economy and fosters improved outcomes, particularly for children. Here at the San Diego Food Bank, we actively engage with our community through outreach efforts targeting various demographics, from individuals, families, to seniors, homeless individuals, college students, foster youth, veterans, and those receiving unemployment benefits. We extend our reach to diverse groups. Our outreach initiatives lead us to various locations where the necessity for CalFresh benefits could make an immense difference in people's lives. We also encounter different barriers when assisting our community that is trying to apply for CalFresh. Barriers like difficulties when understanding the application process, stigmas like public charge and reduction in Social Security benefits when applying for CalFresh for some of the seniors, access to food like lack of transportation or knowledge on ways that they can access it, like delivery services. So we support vulnerable populations by increasing education and knowledge. In conclusion, CalFresh benefits are absolutely vital in our communities. Without the support that they provide to families, consequences could be detrimental. Thank you for the opportunity to present, and now passing it back to you, Joseph.
Thank you, Maria. Yeah, for sure. We can now, kind of using that information on CalFresh, move into the remaining gaps in food assistance and kind of what we can do to try to solve them. So here you can see our missing meals or meal gap data from September of 2023, with all of the food assistance accounted for in September. The hunger sector provided about 77% of the estimated need for food assistance, but this left a meal gap of about 8.5 million meals. You can see, as in this map, areas such as El Cajon, Escondido, and Fallbrook continue to face the largest meal gaps, as indicated by the darker regions in this map. And this is a part of our new interactive maps that allow for an in-depth look at each zip code in San Diego County. Please feel free to visit our research page to get a more in-depth look at this map, as well as other maps that we have on our numbers. But the Hunger Coalition also estimates that there are an additional 241,000 people who are likely eligible for CalFresh but not yet enrolled, showing great potential to reduce the 2024 meal gap by increasing CalFresh participation. Enrolling all eligible families is the best way to decrease hunger and mitigate the effects of the loss of the pandemic era temporary federal programs, as food assistance providers struggle to keep up with the increased need, as we heard from Maria. Next slide. And lastly, all this information that I've presented today is compiled by us by State Assembly District, State Senate District, County Supervisor District, Congressional District, and San Diego City Council in the form of dashboards, updated every quarter and available on our website. Here's one example of the information that the dashboard provides, including the numbers on nutrition and security, food assistance, the meal gap, and CalFresh participation. We hope that this information will help guide your decisions. And that's all I have on the data side. I'll pass it back over to Mauricio. Thank you.
Wonderful. Thank you, Joseph, and thank you, Maria. Next slide, please. Before we jump into our policy slate, I wanted to share a little bit more about how we put this together. Earlier this year, the Hunger Coalition conducted a survey of our partners to get their input on what we should focus on this year. Thank you to everyone who participated and took the time to share their answers. It was immensely helpful in putting together our slate. I wanted to read a choice few responses that were shared with us in our survey. Less paperwork and grant the food and ask for the paperwork later. Some challenges and barriers: overburdensome, duplicative, and sometimes embarrassing enrollment process. Very little payout for the amount of time and energy to both apply and recertify. Concerns about public charge, distrust in public services. Opportunities: increase the amounts that families are receiving through CalFresh, make it worthwhile. We also need to hold whole families in our programs. For example, the limitation of SFSP to go towards parents isn't actually helping children. One of the biggest barriers is when people is asked to send or bring additional paperwork, and people do not have the time or schedule to do it. So with these answers, you kind of see a few patterns that we were able to identify. The burdensome application process, the need to cut the red tape and streamlining it, to kind of redesign programs to meet families where they're at, to look at the whole family to see if a child is hungry, that most likely means an adult is hungry as well, and to increase the CalFresh benefit. When CalFresh benefits are higher, hunger is lower. Next slide, please. So all this really led to our creation of our policy slate. And our policy slate is broken up into two big program areas for CalFresh and also for child nutrition programs. So to speak a little bit more about our CalFresh bills, I'll hand it over to our CalFresh program manager, Ana Evangelista.
Thank you so much, Mauricio. So before I do get into the policy slate, I do just want to reiterate the importance of CalFresh. If we go on our next slide, I just want to start by saying CalFresh is the largest federal food assistance program that provides recipients with money to purchase food each month. Research has shown that every dollar spent on CalFresh actually generates between 150 and 180 in economic activity. This is due to funds being spent quickly and locally, circulating through the economy, and ultimately supporting local businesses. For example, a study conducted by the USDA found that every $5 in new SNAP benefits actually leads to $9 in total community spending. Another example of CalFresh dollars circulating and creating a virtuous cycle in our local economy is their use at local farmers markets, which ultimately, benefits local farmers. Additionally, CalFresh and food assistance are key resources for workforce development. According to the Center on Budget and Policy Priorities, access to food assistance resources like CalFresh can improve health outcomes and reduce healthcare costs, which can in turn, improve workforce productivity and attendance. Furthermore, a study by the University of California, Berkeley, actually found that CalFresh benefits can help low-income workers to remain employed by reducing the likelihood of food insecurity-related absences and turnover. Moreover, the National Skills Coalition has identified that food assistance programs like CalFresh are key resources for supporting low-income workers who are seeking employment or trying to advance in their careers. As you can see from this chart right here on the slide, in September of 2023, in order to meet the need of nearly 830,000 people who are experiencing food insecurity here in San Diego, the food assistance community provided more than 28 million meals. Of the total food assistance provided, 87% of this came from federal food assistance resources such as school meals, WIC, CalFresh, and the remaining 13% came from food banks and pantry partners. So as you can see, CalFresh is a really important program. This year, the Hunger Coalition has identified 8 CalFresh bills These bills fall under the following categories. We have increasing CalFresh benefits, improving access for college students with low income, cutting red tape and removing barriers, and expanding CalFresh access. To speak on our first policy, I'd like to invite Karami Alvarez from the UCSD Center for Community Health.
Thank you, Anna. I'm happy to share my screen. Thank you, everyone, for taking the time to listen to this brief presentation about this particular pilot project. I'm going to go ahead and share a few slides with you so that you can become more familiar with the project that I'm going to be speaking to you about. Can everybody see this, the presentation?
Yes.
Yes, okay. Let me put it in presentation mode. Great, thank you. So again, my name is Karami Alvarez. I work with the UC San Diego Center for Community Health, and I'm going to be talking briefly with you about the CalFresh Fruit and Vegetable EBT pilot project. What is it about? First, I'll start with sharing about the goal of the project. The goal is essentially to develop and to refine a scalable model for increasing the purchase and the consumption of fresh fruits and vegetables among CalFresh participants by, and this is very important, and I'll share this in a second why, by delivering these supplemental benefits to CalFresh participants in a way that can be easily adopted by various authorized retailers of the various types, various sizes, and in various locations for those who are USDA Food and Nutrition Service authorized. Also, the California Department of Social Services, EBT, in collaboration with the Office of Systems Integration, California Department of Food and Agriculture, awarded 3 grants to various nonprofit organizations. And that was the essential goal, was to see different locations in California, how this program was implemented, and see the outcomes that we were getting and its potential for replicability. Who were the awardees? Spur was in charge of coordinating various retailers, as you can see, Arteaga's Food Center, Santa Fe Foods, Harvest Market, and you can see the number of locations, 4 locations, 3 and then 2. Ecology Center is, interestingly, you'll notice here, in comparison to the other retailers, this was the farmers market. So 6 locations in the cities of Oakland, Sacramento, Rancho Cordova, Rialto, and others that were specifically for farmers market. So not the typical brick and mortar retailers, but also pilot testing this nutrition incentive program in farmers markets. And here in Southern California, we at UC San Diego Center for Community Health were tasked with partnering with a great retailer, Mother's Nutritional Center, who has 79 locations across Southern California, including, of course, San Diego County. Now, essentially, what is this program about? You can disregard this for a second. I can explain in a minute why we have this changes to the pilot project, but what is it about and how does it work? Any CalFresh participant who walks into a Mother's Nutritional Center store, at least in Southern California, but as you can see here, any CalFresh participant who goes to any of these locations, but here I'll focus on Southern California, any CalFresh participant who goes to a Mother's Nutritional Center and uses their CalFresh EBT card to buy fresh fruits and vegetables automatically gets that amount of money that they spent on fresh fruits and vegetables, they get that added back or returned rather to their EBT card. So for example, you buy $1 of fresh fruits and vegetables, not canned, not frozen, but fresh fruits and vegetables. Again, the goal of the healthy eating as much as possible. They buy $1 of fresh fruits and vegetables. They earn $1 back on their EBT card, up to $60 per month. Folks don't need to know about the program, though of course we wanted to know about it and are working hard to create awareness, but they don't have to enroll in it. There is no online registration. There's no paperwork. There's really, they don't need to know, but they do benefit from it because automatically, if you're a CalFresh participant, they benefit from this nutrition incentive. We were very intentional in this website to be able to show the CalFresh EBT. So it's not WIC EBT, it's specific to the CalFresh recipients. Now, this is a little bit more of the explaining of how exactly it works. Again, step 1, if folks who have CalFresh use their card to buy any fresh fruits and vegetables at any Mother's Nutritional Center, then for every $1 they spend, they get $1 back, up to $60 per month. And then they get to spend that nutrition incentive, or rather redeem it at any EBT authorized retailer, and they can use that to purchase any EBT authorized item. So to summarize, to earn the incentives, go to a Mother's Nutritional Center and you need to purchase fresh fruits and vegetables. To benefit from those incentives, you can then go to any EBT authorized retailer and purchase any CalFresh EBT eligible food. What were the main goals of this project? There were several, and these were the most important ones: to increase access to and consumption of healthy food. This is why the program really required that folks purchase fresh fruits and vegetables. And the second one, improve nutrition and health status among program participants, improve health equity, including food security, as has been highlighted so far in the presentation, such an important basic human need, food security among program participants, and the new component of pilot and testing new technologies that make it easier to earn and to redeem nutrition incentives. So this was important because we wanted to test the replicability of this type of nutrition incentive program and how it can work across the state and really nationwide in terms of its replicability. And you'll see in a minute, I'll show what the results have been. So I'd like to share with you a brief video that it's 60 seconds and it very succinctly describes what the program is about. I'm going to play it and then I'm going to pause just so you can let me know if you can hear it, because I want to make sure that you're able to hear it. So give me 1 second.
Hey guys, are you ready for more fresh fruits?
Can everybody hear it?
Yes.
Okay, perfect. Thank you. I'm going to restart and play it again. Thank you.
Hey guys, are you ready for more fresh fruits and vegetables? We have some exciting fruits and vegetables items out here.
Oh, I'm sorry, Karemi. I think the audio cut out.
I'm sorry, Mauricio, did you say something? I couldn't hear you.
Yeah, sorry. I think the audio cut out, unfortunately, for the video.
Oh, were you able to hear it and then it wasn't working?
Yes.
Huh. Let me see if I can fix that. 1 second. I'm gonna stop sharing and then I'm gonna share and select on share sound. And I think that's what's gonna help to have it work. Apologies for that. Can everybody see the screen? The presentation?
We can see your desktop.
How about now?
We see your display, not the presentation.
Okay, my apologies. It's technical difficulties a little bit. Okay.
Yeah, it's back.
Okay, it's back. I'm gonna give it one last try, and then if it doesn't work, I'll just skip the video. Does that sound okay?
Hey guys, are you ready for more fresh fruits and vegetables? We have some exciting news for you. The California Fruits and Veggies EBT pilot is now here at Mother's Nutritional Center. Now, when you buy fresh fruits and veggies with your CalFresh EBT card, you can earn up to $60 in incentives per month. Use your CalFresh EBT card to purchase any fresh fruits and veggies, and you will get a dollar-for-dollar match on your card to buy more EBT eligible items. And here's the best part. Those incentives automatically get added to your CalFresh EBT card. That means more money to spend on more nutritious foods. Your balance will appear on your receipt and will roll over to the next month until all the incentives are spent. Sounds great, right? Visit any Mother's Nutritional Center location today and discover the fantastic flavors of fresh fruits and vegetables.
Okay, was everybody able to hear that, Mauricio? Did that work this time?
Yes, loud and clear.
Perfect. Thank you. And I'm going to wrap up because I know we're almost out of time with this particular presentation. Let me just briefly share with you that through this pilot project, we developed various marketing materials in English and Spanish, and actually in Korean as well, toward in the last month. But these marketing materials included flyers, buttons that Mother's Nutritional Center staff wore across all their 80 stores across Southern California to help create as much awareness as possible. We developed posters, among other promotional materials. Importantly, we partnered with over 600 organizations across Southern California to create awareness about the pilot project, including food distribution centers, faith-based organizations, and community centers. We mapped out all these organizations that were within 2 to 5 miles of every one of the 79 Mother's Nutritional Centers in Southern California. And with the help of our partners, including county health departments in Riverside, San Diego, San Bernardino, Los Angeles, and Orange counties, we created social media campaigns, text messaging campaigns that were blasted out in English and Spanish to all the CalFresh recipients. And this really skyrocketed the awareness and the participation in the program. We were fortunate to partner with many organizations, including WIC and the YMCA as examples, who would have posters and flyers about this pilot project in their front offices. It was truly through the great partnerships established that so many thousands of CalFresh recipients have benefited from this program and learned about it. Now, what are some of those key outcomes that we wanted to share with you in terms of the project? Working in partnership with USDA, CDSS, UC San Diego, SPUR, and our other grantees, and of course our technology partners, because as you can see, this pilot project had a big new component, which was the technological component of those nutrition incentives being automatically added when folks purchase fresh fruits and vegetables. So technology partners were critical here at the federal, state, and local levels. Because of this, the CalFresh Fruit and Veggie EBT pilot project truly has shown the efficacy of an electronic point-of-sale nutrition incentive benefit program that can be easily adopted, easily being the key word, which is what we were hoping for, easily adopted by the USDA Food and Nutrition Services authorized retailers. And we were able to see this, that they can be easily used with retailers of various types. As you can see, farmers markets, brick and mortar retailers, various locations, and of various sizes. Hold on just a second, this froze a little bit. Here we go. Key outcomes also increased access and consumption of those fresh fruits and vegetables. Based on our preliminary data, the pilot project did increase access to and consumption of healthy food, including fresh fruits and vegetables, for the CalFresh recipients across California. And it included the increased access and the consumption of new folks who had not been benefiting from this type of program before, including seniors, refugee communities, and community members who are experiencing homelessness. Mother's Nutritional Center, I'll share briefly, did share with us that they began to see new customers that they weren't getting before, including people experiencing homelessness and seniors. The project has successfully shown the efficacy of a nutrition incentive program that instantaneously adds the nutrition incentives directly to CalFresh recipients' accounts when they purchase the fresh fruits and vegetables. Now, this is my last slide. Key considerations. There's an overwhelming need. The pilot project also showed the overwhelming need for programs that address food security. To date, the approximately 75,000 CalFresh recipients across California have earned nearly $9 million in nutrition incentives when they purchase fresh fruits and vegetables at participating retailers. And truly, based on this demonstrated success in increasing the access and consumption of healthy food, while also addressing food insecurity, one of the key questions that we have come up is, moving forward, what are the best ways to leverage this success? And of course, that includes the need for funding. The program has been, in a way, a victim of its own success in that the funding for the pilot project is running out. So I really thank you for your time, and I will pass it to Mauricio to speak to the work being done to secure additional funding for this pilot project. Thank you.
Awesome. Thank you, Karemi. And while we get back on the screen, there it is. I just want to say a huge thank you to UCSC Center for Community Health and to Mother's Nutritional Center. I was fortunate enough to do a few tours in partnership with Karemi and UCSD, and they're located in the backyards of many elected officials. So even if it's not in your district and you're interested to take a tour, I'm happy to set those up. You will see the program live and in action and hear just right then and there just how grateful people are for this program. And I think it also demonstrates just how much of a leader California is in this space. When I first learned about this program, someone over at UCSD Center for Community Health shared that USDA said that never in their lifetime would this happen. And here we are. So we're proving that it is possible and there is a need. But I also wanted to share a little bit more about what's going on legislatively and on the budget side for this program. So like Karemi mentioned, this program is a victim of its own success, and it is running out of money. Assemblymember Lee is leading a $30 million budget request to keep this pilot program up and running and to protect users from seeing a devastating impact and devastating cut. He also introduced a bill that is AB 3229, which seeks to speed up the scoping plan that CDSS is required to provide that will outline the resources and capacity it needs to support an expanded program and become the front door for retailers, rather than having nonprofit intermediaries like Spur, UCSD, and the Ecology Center play that role. And specifically, it calls for that report to be provided by the end of this year, moving the deadline up from March of 2026. So we know it can work, we know it's successful, and we want to make sure that it stays up and running. I will now pass it back over to my colleague, Anna.
Thank you so much, Mauricio. Next slide. We're going to discuss some of the bills to improve access for college students. College students actually have some of the most complicated eligibility requirements for the CalFresh program. Currently, federal law restricts students who are enrolled in higher education, at least part-time, from accessing CalFresh, with certain exemptions, including participation in work programs, such as working 20 hours a week. In 2019, the California Student Aid Commission conducted a survey of student needs. Of the over 15,000 students who responded across all California institutions, on average, over 1/3 experienced either housing insecurity or food insecurity. To speak a little bit more about how this affects campuses locally here in San Diego, I'd like to invite Nathan Gomez and Cecilia Hurlbert from UCSD Triton Food Pantry to share a little bit more about what they're seeing on the ground.
Awesome. Thank you so much. We're prepping our screens to be shared. Just give us 1 second.
Can you all see the screen?
Yes.
Okay,
Yes.
let me come back real quick. Roll ahead. Okay, you're ready to go, Nathan.
Okay, awesome. Well, hi. Again, Nathan Gomez, Cecilia Hurlbert. We are the co-lead managers at UC San Diego's Triton Food Pantry. And today we're just going to be sharing some data points from our fall quarter data report provided to us by the Basic Needs Center. So first off, we are the Triton Food Pantry. The Triton Food Pantry is an initiative from associated students at UC San Diego and was created in fall of 2014. And fun fact, we were created through student need. Survey data like the ones that we just previously heard from Anna, from students addressing gaps in their basic needs. Overwhelmingly, we heard back from students that food was one of the main gaps that they're facing. So thus, we were created to address that need, and we've been providing food ever since. We have a mission of providing a discrete service to UC San Diego students in need of food. We're open 5 days a week at 2 locations. And taking a look at our demographics, in fall 2023, we've helped a total of 13,388 students, of which 3,749 of those were unique. And on average, we're seeing students access us around 3 to 4 times within that quarter. Around half of our students were undergrad, with the other half being graduate students. Around 1/3 of them were first generation, and a large chunk of our students are international students. A large chunk of our the students that access us are international students due to their ineligibility of CalFresh. And the other two largest categories within our demographics are Asian and Chicano students. Next slide. To continue just like looking at how often students are accessing us, a good 35% of our visitors only visit once, whether that be to check us out, see what we have in stock and really get introduced to the pantry, while the other half, 37%, are accessing us over 4 times, demonstrating that need, demonstrating that gap that is there with food. And to speak more on our food programs, I'll pass it over to Cecilia.
Hi, everyone. My name is Cecilia. I use she, her pronouns. I'm a 4th-year student at UCSD and co-lead manager along with Nathan at the food pantry. And I'll be talking a little bit about our other food security programs. The first one being the Food Recovery Network. So the UC San Diego Food Recovery Network recovers edible food across the greater San Diego region and redistributes that food to UC San Diego students that may be facing food insecurity. And they host about 3 pop-ups per week over a 10-week period during the quarter. And looking below in that pie chart, we see that like a large proportion, almost half of students accessing this resource are international students, kind of reflecting some of the data points from the food pantry data. And then in the top right for demographics, there were 894 recorded student visits to the Food Recovery Network pop-ups over a 10-week period in fall quarter, and of which 874 were unique students. So most people are stopping by at once throughout the quarter. And then less than half were undergrad students, with over half being graduate students. And then a third were first-gen students, and almost half were international students, kind of reflecting some difficulties for that population to access other supplemental food programs that undergraduate students or like domestic students may be able to access. And then a fun fact is that our San Diego chapter is one of the leading food recovery groups in the whole United States. And for some more info on the FRN, over the 10-week period in fall quarter, we recovered over 21,000 pounds of food, equating to about 18,000 meals, with 90% of students visiting 1 time and 10% students visiting twice. And that's it for the Food Recovery Network. Our second or third food program is the CalFresh Assistance Form and walk-in appointments. UCSD's Basic Needs Hub, CalFresh Outreach Assistants provide assistance for students by managing the online form and helping students with CalFresh information. So essentially, students can go online and fill out a basic needs assistance form, or walk in and schedule an appointment with a CalFresh assistant who is another student to answer questions on how to submit the CalFresh application, their eligibility, and having that assistant follow up with the county on their case. So looking into the top right, 806 appointments were recorded, with 715 being unique students being assisted over the fall quarter. And a large majority were undergraduate students, with 15% being graduate students. Over half were female students. And then almost a third were Chicano or Latino identifying students, with another third being Asian students. And then in the bottom left, we can see like a large chunk are those junior and senior standing students at UCSD who are accessing this resource. But I think that's all for us. Thank you for having us, and I'm going to pass it back to Anna.
Thank you so much, Nathan and Cecilia. All right, we'll go ahead and share screen again. Okay, perfect. So here are some of the bills that we've identified that will help to increase access for college students. The first bill I want to cover is AB 274, introduced by Assemblymember Bryan. This bill will exempt any grant, award, scholarship, or fellowship benefit being received from students from being considered as income for purposes of determining public benefits. Currently, private scholarships are considered to be counted towards income and prorated for college students. This is confusing and convoluted, to promote the educational expense while also trying to count private scholarships as income. So this bill will hopefully aim to resolve that. The next bill is AB 2033, introduced by Assemblymember Reyes. This bill will require at least one convenience or grocery store on each California community college campus to accept the use of EBT cards. Last bill that we have on here is AB 2150, introduced by Arambula. This bill will require the California Department of Social Services to develop trainings and convene county human services agency staff liaisons to improve access and improve enrollment in public benefits programs for college students. Students should be supported by social services tailored to their unique needs. AB 2150 establishes a statewide knowledge sharing network of basic needs coordinators and county liaisons of higher education. This would require every county to appoint at least one employee to serve as a county liaison of higher education. However, there is a strong demand for regular meetings and coordination between all stakeholders to ensure that all students receive support. All right, next slide. So here are some bills that we believe will cut the red tape and further remove barriers to accessing CalFresh. First bill that we have here is AB 2241, introduced by Assemblymember Alvarez. This bill would require counties to accept a customer's changes affecting their public social services through email. Next bill is SB 1254, introduced by Becker. The Food of Reentry and Ensuring Stable Homes Fresh Act. This will allow and assist incarcerated people in applying for CalFresh benefits up to 90 days before the release to better prepare them for reentry. This bill will also create a work group within the California Department of Social Services to begin recommendations for a statewide reentry process. Last bill to cover here is AB 1975, medically supportive food and nutrition. This will transition MSFNN services to permanent benefits, ensuring access to all eligible Medi-Cal recipients. Medically supportive food and nutrition interventions, or MSFNN, commonly known as food as medicine, are food-based interventions integrated into healthcare used to prevent and treat medical conditions. The spectrum of medically supportive food and nutrition interventions includes medically tailored meals, medically supportive meals, food pharmacies, medically tailored groceries, produce prescriptions, medically supportive groceries, and nutrition supports when paired with the provision of food. Providing this full spectrum of food-based services allows the medical provider to match the acuity of the patient's condition to the intensity of the intervention. AB 1975 sets up the transition of MSFNN services from pilot to permanent in 2 phases. I will now pass it over to Mauricio to talk about our next bill.
Wonderful, thank you. San Diego Hunger Coalition is proud to support Food for All. It is AB 311 by Assemblymember Santiago, and it has an accompanying Senate bill, SB 245, by Senator Hurtado. Hunger Coalition is a recipient of a Food for All mini grant by its bill sponsors, Nourish California and CIPC. Essentially, what Food for All would do, it would expand CalFresh access to all Californians that have been excluded solely due to their immigration status. Currently, 45% of undocumented adults and 64% of undocumented children in California are affected by food insecurity. While CalFresh and the California Food Assistance Program, CFAP, provide a critical lifeline for millions of Californians with low income, these programs unjustly exclude between 690,000 and 840,000 immigrants. Specifically, CFAP excludes undocumented immigrants, deferred action and childhood arrival recipients, DACA, temporary protected status holders, and certain visa holders. This exclusion does not accurately reflect the makeup nor the needs of our immigrant communities. So we are glad that the governor's proposed January budget did not postpone the implementation of Food for All, which is still scheduled to be unveiled or up and running at the end of 2025. So we are really pushing to secure and protect that implementation date. We believe it's unjust to ask for a population that has been excluded forever to wait indefinitely. So we are still saying no exclusions and no delay. Currently CFAP expansion will happen as age-based implementation. So those 55 and older will be the first to be included in the CFAP program. We'll continue to push for the 55 and younger. So that age isn't a requirement to get the California Food Assistance Program. I will pass it back to Anna, who will finish up our CalFresh slate.
Thank you so much, Mauricio. So these are the two final CalFresh bills that we think will help expand access to CalFresh. The first bill here is AB 1967, introduced by Assemblymember Jackson. This bill would create a food insecurity officer to be appointed by and serve at the pleasure of the governor. This person will coordinate and address food insecurity throughout state government operations and be authorized to engage state entities for this purpose. The food insecurity officer will focus on increasing enrollment for seniors, families with children, individuals leaving incarceration, and formerly incarcerated individuals. This food insecurity officer will have a position similar to the county liaison for colleges in San Diego. Last CalFresh bill here is AB 1968, introduced by Assemblymember Jackson. This bill would aim to help connect seniors with CalFresh. Currently, there are several barriers for older adults to apply for CalFresh on their own. First of all, prior to June of 2019, SSI and SSP recipients were ineligible for CalFresh. Some recipients are still not aware that they are now eligible to receive CalFresh benefits. There is also still a lot of relevant stigma surrounding the CalFresh program. We've spoken with some older folks who weren't aware that food stamps have transitioned to a card in the 90s, that CalFresh no longer uses a, stamp booklet. And lastly, a lot of application work for the CalFresh program is done virtually now. And this leads to technological barriers in connecting seniors to CalFresh. So AB 1968 would require the State Department of Social Services to partner with the Franchise Tax Board to identify qualifying individuals 60 years of age or older, and would require the department to create a system to automatically enroll these individuals onto CalFresh. Alrighty, I will now pass it back to Mauricio.
Awesome, thank you. So our next slate of bills focus on child nutrition, specifically increasing access and protecting access to school meals. Next slide, please. The first bill that we identified is AB 2595 by Assemblymember Rivas. This is the Summer Caregiver Meals Pilot. This bill will pilot a program allowing summer meal sites to offer a meal to caregivers accompanying a child. Currently, the Summer Food Service Program, SFSP, mandates that only children and teens ages 18 and younger are eligible to receive free reimbursable meals. But if children of a food insecure household are hungry, it is likely that the parents or caregivers are also facing hunger. In the summer, households experience an increase in grocery spending. Parents and caregivers from food insecure households who depend on free meals for their children are more than likely unable to financially compensate for the lack of meals when their children are home. AB 2595 will combat nutrition insecurity, promote healthy childhood development, and provide families with opportunities to bond over a warm meal by establishing a pilot for state reimbursement for federal summer meal program operators at public libraries to provide meals to parents and caregivers of children in the summer meal program. And finally, our last item is a budget item, and that's protect funding for school meals for all. We support Governor Newsom's January budget proposal, which continues to fund universal access to school meals so that students who want a meal can access to free meals daily. We understand that the legislature is combating with a big budget deficit. However, we feel that this program has been immensely successful and has really captured the students who were uneligible under the previous guidelines, the previous federal guidelines, who were still nutrition insecure but didn't meet the income eligibility. With this program, we have seen those families more accurately captured, and we believe that this program is a success and will continue to support its full funding every year in every appropriations package. Next slide, please. So what's next? You've heard all of the bills. You've heard about the need for hunger here in our region. And I encourage and invite everyone to sign up to be a hunger-free activist. If you feel a desire or a willingness to get involved with our calls to action, be that through sending an email to your legislature or by supporting us via social media, you will receive curated and tailored calls to action directly into your inbox. Or if you are a staff member from a local elected office, you will also receive insider information curated to you, so you will understand where the bills that we're supporting, where they are currently in the process. And lastly, you will get advocacy training to champion hunger relief that works. Next slide, please. That brings us to the end of our agenda, but before we sign off, I just want to say a huge thank you first to our sponsors, 7 Mile Casino, also to my colleagues, Alondra, to Anna, to Joseph, and also to Sarah, the magician behind the screens who was operating our slide deck throughout the entire webinar, to Nathan and Cecilia, to Karemi, and also to Maria. I think today you just saw a handful of people who work daily to end hunger in our region, but that's just a small percent of a multitude who every day wake up and go to work to create a hunger-free San Diego. So I want to say thank you to them as well, and I invite everyone to join us in our advocacy work this year so we can create a hunger-free San Diego. Thank you so much and have a great day.